how we return these meetings to in-person meetings, and we will do so. Although the convenience of Zoom is so good, we probably benefit from doing this way. Certainly, those of you who don't live close to the Hartford area, it's very helpful. Thank you all for coming today. I think we need to begin with attendance. So this is Charlie Klippel.
Thank you. Paul Philpott. CC Woods.
Here.
Thomas McNeil. Mr. McNeil, I believe I saw Mr. McNeil joining us before. Glenn Rader.
Here.
Victoria Veltri.
Here. Good morning.
Steve Hernandez.
Steve Hernandez here.
Thank you. Matthew Brackman. Commissioner Deidre Gifford from DSS.
Present.
Thank you. Claudia Gaultier on behalf of Acting Secretary Jeffrey Beckham from OPM.
Here.
Thank you. Theodore Doolittle.
Here.
Caroline Zambetti on behalf of Commissioner Nancy Navarrete from DMS. Paul Lombardo on behalf of Commissioner Andrew Mace, Connecticut Insurance Department.
Here.
Thank you.
Yeah, Marson, it's Paul. I had to use the call-in line this morning.
All right, great. Thank you. Commissioner Magnusio Tutani, Department of Public Health.
Present.
Thank you.
Thank you all very much. And if I could ask the members of the management team to introduce themselves as well. James.
Sure. Good morning, all. James Michel, CEO of Access Health Connecticut.
Good morning, everyone. Tony Rowe, Chief Operating Officer at Access Health Connecticut.
Good morning, Daryl Jones, Finance Director, Access Health Connecticut.
Robert Blundell, Director of Technical Operations and Analytics.
Good morning, Susan Rich-By, Director of Legal and Governmental Affairs, Access Health Connecticut.
Good morning, Janelle Maloney, Director of Information Technology.
Good morning, Caroline Lee Ruette, Director of Marketing, Access Health Connecticut.
Good morning, everybody. John Carbone, Director of Small Group and Product Development.
Good morning,
everybody. Glenn Jurgen, Director of Human Resources, Access Health Connecticut.
Good morning, Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Mr. Chairman, that concludes our introduction.
Thank you so much. I appreciate that. Good morning to all of you. I understand, Martian can keep me honest here, that we have no public comment.
There's no public comment, Mr. Chair.
Thank you very much. So we'll move on to the minutes of the last meeting. Are there any comments or corrections to the minutes from the last meeting? If not, could I ask for a motion to approve those minutes?
So moved, CC Woods.
Second. Thank you, CC. Thank you, Tom. This is Charlie Klippel. Yes.
Thank you. Paul Philpott.
Yes.
Claudia Gaultieri.
Yes.
Deidre Gifford.
Yes.
Glenn Rader.
Yes.
Steve Hernandez.
Steve Hernandez, yes.
Thank you. Theodore Doolittle.
Yes.
CC Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Veltri.
Yes.
And Matthew Brackman. Thank you.
All right, James, the floor is yours. Thank you.
Thank you, Mr. Chairman. Good morning, all. And again, I'm James Michel, the Chief Executive Officer for Access Health Connecticut. Welcome to our June 2022 board meeting. Before I begin my comments about our meeting today, I want to share an important update with the board. Vicky Veltri has been on our board since the very beginning. We wouldn't be where we are today without her support. She has spent the last 10+ years providing dedicated and engaged service to Access Health Connecticut. Governor Lamont issued a press release last week announcing Vicky's departure from state public service. Her new role as executive director at the Malta House of Care prevents her from continuing to serve on our board. By statute, anyone who works for a provider cannot serve on our board. Her last day at the Office of Health Strategies and as a member of our board will be June 30th. We will miss her at the Office of Health Strategies and at Access Health Connecticut. I want to personally thank Vicki for her service and contribution to our organization. Vicki, thank you very much. We wish you well as you move forward. We are also working with the government. You're quite welcome. Vicki,
I will lose it if I say anything more, so I'm just going to stop there. Thank you so much.
We are also working with the governor's office to find a replacement as soon as possible. But Vicki, the entire staff, you've been very engaged, very hands-on with us since the very start. It is greatly appreciated. There's no doubt that we would not be where we are today without you and also other board members as well. And we are recognized as one of the better exchanges in the country, if not the best exchange in the country. And obviously, you had a lot to do with that. So for that, I'm personally appreciative of your commitment and service to our organization, and ultimately the benefit of Connecticut residents, which as you and I share a very passion of helping people. Thank you very much.
Thank you so much, James. I will say I will miss everybody on here. I've said this on repeated calls. There are so many people. I'm gonna start losing it, that I love and have worked with for a long time. And just because I'm leaving this board doesn't mean I expect to not see all of you. So I will see all of you, but thank you so much. It's been a great experience being on this board since the nascent days of the exchange, before it even had its name, with a couple of other people. And you've come a long way. And I really appreciate everybody on the staff, the board members, etc. So I'll miss you all, but thank you so much.
Thank you.
This is CC Woods.
Yeah, sorry, CC, go ahead.
Oh, I'm sorry. Vicki, you've just been a shining light and an inspiration to everyone on this board. You've always been so well informed, and you have just made the exchange what it is today. And so thank you on behalf of all my colleagues. And Grant and I have been with you for a long time, so we really appreciate what you've done.
Thank you, CC.
Stephen Hernandez has a comment as well.
Well, thank you so much. You know, I'm relatively new compared to some of my fellow board members to this board, but I am not new to the gem of the state and the jewel that is Vicki Veltri. And you know, I've watched you just give of yourself in public service to the state for so long, including in this charge. And just know that you're leaving behind, in this case, a wonderful legacy. But I know your work continues. So sending much love, Vicki.
Thanks so much, Stephen. And I know I will see you.
Vicki, we could take the rest of the meeting to do this, but let me say on behalf of all of us, thank you so much for your service on this board, for being such a great colleague and friend to all of us, and such a wise head and advisor for the organization. We greatly appreciate it. Thank you.
Thank you, Charlie.
Regarding our meeting today, we will begin with an update about the new Health Equity Outreach and Consumer Experience Advisory Committee. Susan Richbard, Director of Legal and Government Affairs, will walk us through our work with the Strategy Committee to establish this new committee and its proposed members. Then right after that, we will take a vote on the new members. Following Susan's remark, we will hear from Tammy Hendricks, Director of Health Equity and Outreach. Tammy will share an overview of where we stand with the Broker Academy. It's been fast-paced and exciting few weeks, including the 3-day in-person classes that took place on June 1st, 2nd, and 3rd. I want to thank Tammy, the entire staff, our community partners, and our board for your continued support as we continue this first-of-its-kind program in the country. Additionally, we have great news about funding for the Broker Academy. We are pleased to share that Access Health Connecticut was recently awarded a $20,000 grant from the Fairfield County Community Foundation in support of the Broker Academy. And this fund has to go towards supporting the candidates in our program from the greater Bridgeport community. We are awaiting several more grants that we have applied for, and we'll keep the board updated as more news becomes available. After the Broker Academy update, we will hear from Director of Marketing Caroline Lee Rouette about marketing and outreach efforts to support Phase 2 of the Cover Connecticut program. Director of Technical Operations and Analytics, Robert Blunder, will also update the board about changes made to our system to support this next phase of the program. We have a large working group that has been meeting regularly to ensure a successful launch. And I want to thank the Office of Health Strategies, our carriers, the Department of Social Services, our Access Health staff, and all who participate in those planning meetings. We will hear from Rob after this morning, but I'm pleased to share that we have identified approximately 11,000 customers that will become eligible for the program starting on July 1st. And we will immediately enrolling them into the program. A request was made at the last board meeting about setting goals for the Cover Connecticut program. The Office of Health Strategy has identified annual enrollment goals for the next 5 years. For this year, Office of Health Strategies has targeted 2,818 enrollees in the parent and caregiver relative demographics, 15,903 enrollees in the childless adult demographic. This is a total of 18,721 enrollees as the goal as identified by OHS. I think we are well on our way there, given 11,000 that we're going to enroll starting later this month to be effective on July 1st. Susan will continue. After our Cover Connecticut update, we will continue into discussion about the status of several audits led by Susan. We are entering into audit season. And we have several audits starting. And Susan will also give you a report on the SMART audit, which is a requirement by CMS that we do annually. And that was just completed last month. Then Susan will wrap up with an update on all the Affordable Care Act policy and legal updates that she does for us on a regular basis to keep us updated in where we are. Now, one quick comment about I do want to share with the board and then about the expiring American Rescue Plan, ARPA financial help. We have been fiercely advocating for for Congress to extend the American Rescue Plan Act. Our focus has been on both the impact to Connecticut residents, as the financial help is not extended beyond 2022, and the timing of this decision. While Congress has many important pieces of legislation to consider, timing is of the essence. We sent out 2023 renewal notices to our customers in October, including anticipated increases to premiums. This is why it's critical the decision is made rather sooner than later, so that those notices are not shocking to our customers for next year. With ARPA financial help set to expire at the end of this plan year, this will be a significant challenge to Connecticut residents who are currently benefiting from the ARPA subsidies, enhanced subsidies. If you remember last year, when we presented to the board, some of our Connecticut residents' premiums went from excess of $1,000, $2,000, and $3,000 down to single digits or double digits of monthly premiums. With ARPA expiring, they go back to those numbers, if not higher. Access Health Connecticut will continue its efforts to raise awareness about this important issue through outreach to our local legislature and the DC delegation, which we have been doing since earlier this year. And we'll continue to press them. And we met with Representative Courtney last month to make him aware, and he's fully engaged, fully aware of it. But we have meetings scheduled to meet with the balance of the of our elected officials in DC. Mr. Chair, this concludes my opening comments. I'm open to any questions.
Thank you. Are there any questions before we move on? If not, then Susan, if you would be kind to pick up the agenda from here.
Thank you very much. Susan Rich-Bai, Director of Legal and Governmental Affairs. You could move to the next slide, Martin. Thank you. So as James mentioned, we'd like to update you and also propose some new members and some cleanup votes for the new Health Equity Outreach and Consumer Experience Committee. So if you recall, the Strategy Committee recently reviewed the advisory committee structure and made recommendations to the board, which this board approved, to expand the Consumer Experience and Outreach Advisory Committee to now be known as the Health Equity Consumer Experience and Health Equity Outreach and Consumer Experience Advisory Committee, so that it includes a focus on health equity and also to bring navigators and individual brokers to the work of this committee. And as you recall, as part of this effort, the Brokers, Agents, and Navigator Committee was dissolved. Tammy Hendricks, who is our Director of Health Equity and Outreach, will be the staff lead for this committee, and she's been working with the committee chair, Ted Doolittle, James, myself, Margot, and Martin on new members for this committee for its expanded focus. We also reached out to current members of the committee to find out who is still interested in serving and who would like to be removed from the committee. The members remaining on the committee are Ted Doolittle, who is the chair, Cece Woods, Deb Poland, Sheldon Taubman, Gerard O'Sullivan, who is a subject matter expert for the insurance department, and Kevin Galvin. We are proposing to add 3 new members at this time: Karen Siegel of Health Equity Solutions, Giselle Carlotta McDonald of Project Access of New Haven, and Leslie Greer of the Office of Health Strategy for the state of Connecticut. Karen Siegel is the Director of Policy at Health Equity Solutions, and she is very knowledgeable and passionate about promoting health equity through the Children's Medicaid program from her prior experience at Connecticut Voices for Children, and she's also very knowledgeable and passionate about issues of social and racial justice in Connecticut. Giselle Carlotta McDonald started her work at Project Access of New Haven as a bilingual patient navigator back in 2011, and she's currently the executive director of the organization, which is really wonderful to see. She is a native of Buenos Aires, Argentina, but has also lived in many countries around the world. Her interest in cultural diversity informs her work advocating for community health, equity, and equality. Project Access has also served as one of our navigator organizations since 2020, so this is a wonderful fit. Leslie Greer is an outreach coordinator, consumer representative at the Office of Health Strategy for the state of Connecticut. Her work focuses on coordinating community forums and engaging stakeholders on health system changes with regard to the Certificate of Need program that is operated at the Office of Health Strategy. In her work, she interacts with healthcare consumers, listening to their concerns and perspectives to help improve the Certificate of Need program and also, most importantly, health equity in the state of Connecticut. And then finally, the following members have been asked to be removed from the committee or have stepped down, and these include Alta Lash, Anita Cotto, Arlene Murphy, Erica Michalowski, Susan Kelly, Cheryl Forbes, Victoria Beltry, and Tanya Barrett. So we have 2 votes for you today. So I will open it up for any discussion.
Come on, kiddo. Winnie, you come in. You come inside. Come on. Winnie, come inside.
Mr. Chairman.
Are there any questions for Susan? If not, she's asked us for 2 votes. And the first is to appoint the new members to the committee, Karen Siegel, Giselle Carlotta McDonald, and Leslie Greer, to join the Health Equity Outreach and Consumer Experience Advisory Committee. Could I have a nomination for that? A motion for that vote?
This is Ted Doolittle, Office of the Healthcare Advocate. So moved, Mr. Chairman.
Thank you, Ted. Second?
Second by Cece Woods.
Thank you, Cece. Charlie Klippel, yes.
Thank you. Paul Philpott. Claudio Gualtieri.
Yes.
Deidre Gifford.
Yes.
Grant Ritter.
Yes.
Steven Hernandez.
Yes.
Theodore Doolittle.
Yes.
Cece Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Beltry.
Yes.
and Matthew Brackman.
Yes.
Thank you.
Thank you all. And then a second vote to remove from the committee those individuals that Susan identified: Alta Lash, Anita Cotto, Arlene Murphy, Erica Michalowski, Susan Kelly, Cheryl Forbes, Victoria Veltri, and Tanya Barrett to be removed from the committee. Could I have a motion for that vote, please?
Mr. Chairman, Ted Doolittle again, so moved.
Thank you, Ted. Second?
Gifford, second.
Thank you so much. Charlie Klippel, yes.
Thank you. Paul Philpott.
Mr. Chair, if I could I just make a comment before we vote?
Absolutely. I'm sorry, for sure.
No worries, Mr. Chair. I just want to recognize that there's a real depth of community engagement experience that we're gaining with our new additions, and I'm thrilled to have those. And but I'm also recognizing we're losing some reach in key areas. Particularly, I'd love to maybe engage with our AARP Connecticut folks who have such good community outreach programs to make sure that we can try to find some other suitable alternative as these people time out or decide to move on to other things. So let's continue to look to fill out any gaps that may exist from the people we're removing, recognizing their great service up to this point. Thank you.
Mr. Chairman, very quick comment. Claudia, thank you for those comments. We have engaged with AARP because we are targeting the 50 and above through our marketing because that's a population that needs access to health insurance. So we have been engaged with them. So we will expand that engagement to include recruiting for this committee as well. Thank you.
That's excellent, James. And I know we had talked on some other board retreats and policy development for our board about how important that transition is from exchange products onto Medicare and how we could help smooth that pathway. So love to see your leadership and initiative there. Thank you, Mr. CEO.
Thank you.
Thank you, Claudia. Very well taken points. So thank you very much. We were sort of mid-vote. Marcin, can you pick up from there? And
yes, Mr. Chair. Paul Philpott. Claudia Gualtieri.
Yes.
Dietrich Gifford.
Yes.
Ron Ritter.
Yes.
Steve Hernandez. Mr. Hernandez.
Steve votes yes.
Thank you. Theodore Doolittle.
Yes.
Cece Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Veltri.
Yes.
And Matthew Brackman.
Yes.
Thank you.
on behalf of all the board, I want to record our thanks to all of those who served in this role and are leaving the committee now. Thank you very much. Vicki, that includes obviously your service. Thank you so much. I think our next item is the Broger Academy. Tammy?
Yes, good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. I just wanted to say thank you, Vicki, for all you've done for Access Health, and I wish you all the best. So we're here today for some Broger Academy updates, and I am so excited and happy to report that we've successfully launched the Broger Academy first class 2 weeks ago. I've included some photos here on the slide just to try to capture the energy over the 3 days, but of course it's hard to do that through the photos. But I hope you can at least get an idea of what went on over the 3 days. It took a tremendous amount of work to pull this all together, and all the outreach efforts, the events, the presentations. We hosted weekly calls for the students before training, which helped them really prepare for the first day of class. And I think that contributed to the consistent attendance as well. But even though we weren't doing the actual training, we had our teams present on site for all 3 days, including myself and other directors. James took the time to visit all the locations, spoke with the students, reinforcing why Access Health as an organization decided to do this program and the positive impacts they'll have in their communities after they've completed the class. So really motivating them on the first day. So as far as the staff, you know, we really work between the class breaks, taking our meetings, getting our work done, meanwhile setting up the locations with goodie bags, transporting laptops. We distributed 68 laptops on the first day. 3 students decided to use their own laptops. We made sure breakfast and lunch was set up and available for the students, and coffee, of course. And so, you know, we were there. And most importantly, we were cheering them on and encouraging them along the way. It was quite a lot of information. So collectively, our team made this launch a success. All departments played a role at some point in the planning and executing of this program. So it was rewarding for us to see the results of our hard work. So a lot has been done to get to this point of actually launching the class. The in-person classes were held on June 1st, 2nd, and 3rd as planned. Kaplan provided 3 really wonderful instructors. They were engaging throughout the 3 days. All the 3 locations, the community colleges, were so accommodating and very easily accessible for the students. So there was no issues getting there and getting to class on time. So in total, we had 71 students across all locations. And these students were energized and motivated, as you can see from the photos. It was interesting, though, to see the demographics of the new class. We realized that the classes were majority female. And we don't have the exact percentages, but from first glance, a lot of the certified brokers that are Access Health certified brokers seem to be majority male. So we did a short survey and we found that 85% of the class in Bridgeport identified as female, 64% in New Haven, and 75% in Hartford, which was our largest class. So we brought in a very diverse class to enter the broker community, diverse in geographical location, right? Those underserved areas, but also in ethnicity and in gender. So this program was definitely very successful in more ways than one. But during class, we kept them going with coffee and food. The instructors kept them engaged the entire time. So despite the course load, attendance stayed consistent. All the students that started the course completed the course. And all 70 students passed the class exam, passing rate of 99%. And of course, this class exam is important because it's a prerequisite. So it's required for them to pass this class in order to sit for the state exam. So for the student who did not pass, they still have access, all the students have access to trainings and materials still through the Kaplan portal. But it was a fantastic pass rate. Many of those students hadn't been to school in years, in some cases decades. And it was a very impressive class average of 86.9. This was for the New Haven location, but we think that the class average will be about the same for the other 2 locations. So very high class average. But the students were all so excited and thankful for the opportunity to start this new career, right? This is really the first step for them, and passing the class test, it's a prerequisite course, now allows them to sit for the state exam. And so our goal now is to have all the students licensed by the end of July, so they can start the mentorship portion of the program in August, right? So, and then moving on and getting ready for open enrollment, which was the ultimate goal for the program. But I wanted to take some time out to thank some others that have really supported us since the beginning of the program. A few guests made some virtual appearances during the 3-day class. This includes Governor Lamont, Commissioner Andrew Mays, Ted Doolittle, and a representative from both carriers, all recorded welcome videos, which were played during the class days. And the videos were well received by the students and the staff. And we truly appreciate their support throughout the process of standing up the program. But we also had some guest appearances during the class as well. So the CEO of Capital Community College, Dr. Duncan Harris, and the CEO of Gateway Community College, Dr. William Brown, they also stopped in and spoke with the students. Both were so encouraging, and also sharing what community colleges have to offer, which a lot of students did not know about. So very, very inspirational speeches and recorded videos for the students throughout the process, which kept them very motivated. But I wanted to point out, in one of the photos, you'll see a big blue banner, and it was from Capital Community College, and it says creating access and changing lives. And it's so fitting because that's exactly what we're doing with the Broker Academy, right? So I thought that was very interesting that that motto lined up with the goal of the program. Of course, we want to thank all the churches, community organizations, the nonprofits, other state agencies, and the community colleges, of course, that hosted our class. A special thank you to the Connecticut Health Foundation for awarding us our first grant that helped us in our outreach efforts to promote the program. But this past weekend, as James stated, we received another grant from the Fairfield County Community Foundation. So we're waiting for responses for 3 other grants, but we are so thankful for both organizations for believing in the program and showing their support. So I know I've been going on a lot. I'm trying to capture everything that happened in this 3 days. So to wrap up here, the next steps, the team is working on getting the students scheduled for the state licensing exam when they're ready. We are encouraging them to sit as soon as possible, of course, after all the information they've retained over the 3 days. And they also have time to study as well if needed. They do have access for 6 months to the portal and all of these study resources. We are continuing to plan our weekly or bi-weekly calls to keep them engaged as we did before training, just to make sure that they are progressing through the program and that they are meeting all the goals and feel comfortable moving forward. And finally, we are working on getting mentors signed up for the program. We have some agencies interested already, so we are looking to recruit some more, of course, to make sure that the students are evenly distributed. So we are looking to finalize that first group of mentors, hopefully by the end of the month, giving us some extra times, a few weeks to get some more agencies in. So more to come on that. But thank you so much to everyone. Our board, launching this program has not been easy. We appreciate your support and encouragement. This program has made a significant impact already, and it's just the beginning. Again, the timing of this program was designed to have these students ready and trained for the start of open enrollment, and we are on track to do just that. So we're excited to continue to progress through the program. And I will stop here and answer any questions or go through any comments.
Charlie, you're on mute.
Yes, I am. I apologize. Comment or question from Ted Doolittle, please.
Yes, thank you, Mr. Chairman. Ted Doolittle, Office of the State Healthcare Advocate. I just want to thank Access Health and Tammy for including the training segment on the Office of the Healthcare Advocate. I think it's really important for all brokers in the state to understand that the product that they are selling is terrific, but it is complex to use, often unfamiliar to folks, and they should know that they have this hidden jewel of free expert assistance and representation from OHA, our nurses, paralegals, attorneys, and others who help people with claim denials and other things. So I thank you for, I think it's a big breakthrough to have this incorporated in the Broker Academy training, and hopefully we can move that to other training for other brokers as well. But I did want to express my appreciation to James and Tammy for including the OHA training segment. Thanks so much.
Thank you so much, Ted. It was very helpful. And I know, it takes some time to do that recording. I know you did it a few times for us, so very much appreciated. And the students appreciated the information. Thank you.
Thank you. Any other comments? It's so great to see this program in actual, moving forward as it is right now. This is just terrific. James, this has been your brainchild and advocacy for a long time, and it's terrific to see it come to fruition. I know you think about it both as expanding the reach of the exchange, but also launching 70 careers, and I think that's just a wonderful thing that this board has supported and look forward to continue to support. So thanks so much for the update, Tammy.
Thank you.
I think our next speaker is Carolyn Lee. Am I correct?
Correct.
Carolyn?
Good morning. Caroline Lee Ruette here, Director of Marketing at Access Health Connecticut. I have the privilege here to provide an update from marketing and outreach perspective on the Covered Connecticut program. So I would be particularly remiss if I did not thank you, Vicki, for all of the service that you have done on behalf and with Access Health Connecticut over the last several years. You were instrumental in creating this program that provides access to Connecticut residents to the important healthcare at the most affordable rate, right? Our goal at no cost to them. So thank you very much, Vicki, and it's my privilege to provide this update for you and the board on Covered Connecticut from a marketing and outreach perspective. To that end, from a marketing perspective, we are launching on July 1st with new digital content. Chiefly, that is our knowledge base article. That is the very long piece of content on our website. It provides an overview of what the program is, who is eligible, what that eligibility criteria is, how to enroll, as well as frequently asked questions. We've worked, as James mentioned, with a big working group over the last several weeks and months, right? The carriers, thank you for your help, OHS, the Department of Social Services, lots of hands in this cookie jar. And our content is really directing people to the most important information for this program as it continues, but also for the new benefits as it relates to dental and the non-emergency medical transportation. In addition to that, we do have a downloadable and shareable one-pager document. This is excellent collateral for all of us to be using to provide consistent messaging about the program and will be very important for our outreach efforts too, so that there's a tangible document that folks can pass out and share with those who may be eligible for the program. We're also planning a press release and a press conference. Those plans are not finalized yet, but we will work hard to make sure that you are aware of who, what, when, where, why, so that you can attend and potentially see the coverage about this. Using the media is particularly important to raise awareness, and so we are working hard to coordinate those efforts as well. Other marketing efforts are also underway to support the program, including direct-to-consumer efforts, right? That is our direct mail, email, SMS, or text messaging campaigns. We're going to have a robust social media campaign, an updated toolkit, and more. And all of that will be shared just shortly after launch. In addition to marketing, right, we work hand in hand with outreach. I already talked about that shareable one-pager, which is going to be excellent collateral for our team and other outreach teams to use. But really want to touch on the fact that outreach is focused on incorporating Covered Connecticut into their scheduled events right now. That's a robust calendar, as well as the regional planning meetings that many of you have attended and are ongoing during this month, as well as their Healthy Chat events. In addition to that, outreach is focused on increasing training for the certified application counselor community, growing that population, and increasing the organizations that we're working with for that CAC program. Additional training is also being expanded and starting earlier this year for those CECs in advance of open enrollment. As we all knew, these certified application counselors are critical partners that we need all year and during open enrollment. So the outreach team has already made significant strides, particularly over the last 2 months. Congratulations, Tammy and your team, to growing this population and educating them with an emphasis on the Covered Connecticut program. So that's really what we're doing from a marketing and outreach perspective. And I'd like to turn it over potentially, unless there are any questions, so that we can talk about the technology, right? Because there's technology updates too. So I'll pause here in case there's any questions from a marketing and outreach perspective.
Mr. Chair, I have a question.
Thank you. I don't think there are any questions, so please continue.
Mr. Chair, I do have a question, if I could.
Sorry, please.
No worries. Thank you for the update. Can you just talk a little bit more about how the carriers are working together with Access Health on these outreach events?
Sure. I can do an overview and then toss it to my colleague Tammy to provide some detail at her department. But ultimately, the carriers we share our events with them so that they can collaborate with us. But Tammy can provide some much more detail about that.
So both carriers are invited to all of the events that Access Health plans, but also we share events that are public events that we go to, which are typically sponsorship events or tabling events, right? So for those, we do share those events so they can purchase a table and attend those events. Those are public events that are open to everyone. But for the events that we plan, like the regional planning meetings, we do invite both carriers to attend those meetings, and those meetings consist of CACs. We have some brokers and community partners that get together. We give them an update, but we also have a brainstorming sessions where, of course, both carriers can be a part of those conversations and get feedback from CACs, brokers, and community partners, if that helps your question.
Thank you.
No problem.
Thank you. Technology?
So I have a few updates on the technology front about the work that our teams have been doing to ensure the system is ready for Covered Connecticut eligibility and to enroll residents in the most efficient and convenient way possible. So as a reminder, Connecticut's legislation rolled out Covered Connecticut in 2 different phases. The first phase was that the medical benefit of the Covered Connecticut parents and caretakers would be rolled out on July 1st of 2021. This is the 860 enrollees who are currently benefiting from the Covered Connecticut benefits. And then the second phase was to roll out a provision for the medical benefit of childless adults, and that would be starting July 1st of 2022, as well as, in addition to that, the non-emergency transportation benefit, NEMT, as well as dental benefits that would also go into effect for Covered Connecticut enrollees on July 1st of 2022. So we are very grateful for that staggered implementation for phase 2, as an immense amount of work had to go into making that happen. A ton of coordination with DSS, the carriers, ASOs, the support teams at the state level, at the community level, to ensure that we can deliver that functionality and support and administer the program. So we're now in the last mile of that implementation, and I wanted to share with the board what we're doing from a system perspective this month to roll out these benefits in as seamless as possible of a manner. So a couple of updates here. So last Friday on June 10th, we released new functionality in our system, which would allow anyone to be determined eligible for Covered Connecticut to enroll without a qualifying life event. This automates the policy we changed we made earlier this year and removes any kind of potential barriers that Connecticut residents might have in accessing this plan that would offer them essentially $0 cost coverage. So we're really excited about that. They no longer need to utilize our call center. It'll be completely automated end to end. In addition to that, this Friday on the 18th, we'll be conducting 2 major efforts. The first is we'll begin transmitting information for all of the existing 860 enrollees in Covered Connecticut to DSS, the dental and the non-emergency transportation providers. What this means is those residents will gain access to those benefits without having to take any kind of action. It'll be automatically applied to them. They'll receive a communication from Access Health explaining the fact that we're sending that information over to further enhance the Covered Connecticut benefit. And then they'll also be receiving a welcome packet from the Department of Social Services on behalf of their providers with benefit cards and onboarding information for those individuals. The second feature we're releasing is an updated eligibility engine rule, which will allow us to grant Covered Connecticut coverage to that second phase of Covered Connecticut, the childless adults. And that'll be for coverage starting July 1st of 2022. So we're very excited about that. It's going to be a large group of individuals who can benefit from it. Lastly, on June 30th, we'll be completing the last major technology effort for Covered Connecticut. We'll be identifying the existing enrollees that we currently have who meet the Covered Connecticut childless adult eligibility requirements. And we'll be taking action to make sure that they can benefit from that program without having to take any kind of action themselves. So what that means is we'll be automatically applying the Covered Connecticut benefits to them. And from that, there's quite a bit of effort that's involved there. We're currently mining our enrollment data and identifying who those enrollees are. We're doing a significant amount of review and quality assessment on that to make sure that all those folks do qualify. And so far, our estimate right now is that there's going to be a little over 11,000 folks who are eligible for that. By early next week, we should have the final or official number of that once we complete that quality assessment. There's still reconciliation we're doing between our lists and quite a bit of effort to make sure we've got that nailed down. So bear with us. Those numbers are still very much approximations, and an official figure is coming soon. So once we complete that, that'll complete really the major Covered Connecticut technology implementations by that July 1st implementation date. We've spent a great deal of time and effort to make sure that we can deliver this program in as an automated fashion as possible. As we approach that finish line, I just wanted to officially thank the Access Health technology teams, the DSS teams, the carriers, the support teams from the state groups, many of who are on this call, so thank you, as well as the community stakeholders who've been involved. There's been a lot of effort over the last over 12 months on this. So I just wanted to say my thanks and also reflect on the fact that we should all be proud of the efforts we're taking to roll this out. And we're very excited for July 1st and more importantly, June 18th, which will roll out a major provision of this. So thank you. I'll pause there for any questions.
Commissioner Gifford.
Thank you, Mr. Chair and Rob. I did just want to also let the board know the status of the DSS side of the Covered Connecticut program. You'll recall that this program is a joint effort, and I think this definitely falls on the list of things to be proud of here in Connecticut. It's been really a joint effort between OHS, DSS, and Access Health Connecticut, in addition to the carriers. And the funding to cover those out-of-pocket costs that aren't covered by the ARPA subsidies or the regular ACA subsidies, we hope be covered through a Medicaid demonstration. So you'll recall that we have submitted to CMS what's called an 1115 demonstration application. And we are hoping that, as they do in Massachusetts and a couple other states, CMS will approve that whatever isn't covered through the regular ACA subsidy process will be covered as a Medicaid benefit under this demonstration. Not only the non-emergency medical transportation and the dental benefit would we get our federal share, but also the out-of-pocket costs for the consumers. So we're really kind of leveraging this Medicaid demonstration process. CMS is actively reviewing that application. We don't have approval yet. We are in close touch with CMS and quickly responding to any questions or concerns that they have. But as soon as that demonstration application is approved, we'll be able to get 50% or more federal share for the coverage of those out-of-pocket costs, the other half of which the state will pay. So, more to come as we wait on CMS's approval, but I just wanted to remind the board that there's this other piece of the launch that's still in play. As Rob said, we're in pretty much daily contact, our teams between DSS, OHS, and Access Health. Thank you, Mr. Chair.
Oh, thank you. That's a terrific update. Really appreciate it. And I know this board offers all of its support toward your 1115 waiver. So if there's anything we can do,
Yes.
it's a very important action that you're taking. Thank you. Any further discussion on Cover Connecticut?
CC Woods, one question. Could someone
Sure.
refresh us on the income eligibility limits for the program?
I can, CC.
Okay.
The income eligibility thresholds, they are essentially 175% federal poverty level is the cutoff, and the floor is if the individual is ineligible for a Husky program. So the FPLs that should be kept in mind is for the parents and caretakers group, that's 160% of the federal poverty level. For the childless adults, that's traditionally 138% for Husky. This has been a challenge we've had from a communication perspective. We've been trying to refer to it essentially just to simplify things as 175% of the FPL and ineligible for Husky benefits. And Caroline has a chart that she's put together in her communications, which shows the financial amounts by the household size to help convey the dollar amount more easily to individuals.
And CC, we would share that collateral with the whole board, so you could distribute it to your own network. And it clearly states a family of 1, family of 2, 3, 4, and all the way up to family of 8, what the threshold is in terms of income level.
Okay, that's what I was getting at. Thank you very much. Yes.
Thank you very much. No further questions, then I'll ask Susan Rich-Bai to take the floor again. Thank you.
Thank you, Mr. Chair. Now we have an audit status update on a few audits. So for FY22, which is about to finish, we are launching our financial and programmatic audits. These are requirements that the exchange has to do both under federal law and under state law. So we engage an independent auditor, and it is currently Clifton Larson and Allen to do this work for us on these audits. They are doing their preliminary work right now and actually presented their opening to the audit committee last week. And then they will commence their field work at the end of August. And then the proposal is to have draft financial statements ready for us by the end of September, and the final financial statements for the end of October. And then the audits will be presented to both the audit committee and the board for approval. And just a note for everyone, because of the grant that we have received under the American Rescue Plan Act, the American Health Benefit State Planning and Establishment Grant, which we are very grateful for, we will be required to do a federal single audit for FY22. So that is something new. We had done those in early years when we had a great deal of federal funding and then had not been required to do those for many years, and we are required to do it this year. So that will be included in the work that Clifton Larson and Allen is doing on our audit. The other item is the state-based marketplace annual reporting tool, which we also call the SMART. The ACA requires state-based marketplaces to keep accurate accounting of all activities, receipts, and expenditures, and to monitor and to report to U.S. Department of Health and Human Services on our exchange-related activities, and to complete an annual report, which is the SMART, and to engage an independent auditor, as I just mentioned, to perform the independent financial and programmatic audits to ensure compliance with standards and regulations. And just a reminder, back in 2015, CMS developed the SMART to make it easy for exchanges to put all of their reporting requirements into one easy online report. And this report has 4 components. The first is eligibility and enrollment. The second is the financial and programmatic audits. Then there is also a section on program integrity, and finally, the attestation of completion. The SMART is due on June 1st of each year. The schedule was changed during the first year of the pandemic, but we're back to the June 1st schedule. And we filed our SMART for 2021 on May 31st, and we anticipate hearing back from CMS in a few months. We did not find any issues when completing our responses, and we don't anticipate any recommendations or findings on our SMART. I will answer any questions if anybody has any.
Ted Doolittle, please.
Thank you, Mr. Chairman. Ted Doolittle, Office of the State Healthcare Advocate. Susan, is this Clifton Larson Allen's first year with us? And remind me how many years we can keep an independent auditor?
Good questions. Thank you, Ted. This is not their first year. I think this is their second year. We have two different requirements that come into play here. The first is under our enabling legislation and our procurement policy for professional services such as auditing. We are required to do an RFP process every 3 years, which we do. And then there is also a separate requirement that I believe is under the Quasi-Public Act that a quasi-public may not use the same auditor for more than 6 years in a row. So we had previously used Whittlesley for 6 years, and we've been using Clifton Larson and Allen actually is a successor to Blum Shapiro. We had started with Blum Shapiro and they were acquired and merged into Clifton Larson and Allen. So I think we're in our second 3-year period with them.
Okay, so that explains why I didn't recognize the name. And
yes,
so,
yeah,
so they,
it's
so,
a
so
successor
they
to
have one more year on the
Shapiro.
contract then? One more year on this contract, and we could renew it for another 3 after that.
I believe so.
Okay.
And we actually have, I have Nicoletta McTighe is on the call, if anybody, who is the partner in charge of the audit, on this call with us today. So if anyone has any questions for Nicoletta.
Thank you, Susan. Are there any further questions? If not, then Susan, I think this is also your topic.
Yes,
so
thank you. So we have our ACA policy and legal update. As James mentioned in his CEO update, the ARPA subsidies and the congressional action needed to extend these has obviously been a very, excuse me, important topic for us that we've been engaging on for a very long time through our NASHB group and through our congressional delegation. And as James mentioned, the timing is very important because the renewal notices go out in October, telling consumers what their subsidies will be and their premium amounts for 2023. And we're still, waiting and hoping for Congress to take action. The hope is that they would maybe take action by the August recess. But as you all know from watching the news, there is a lot going on in our country right now that Congress is also engaged in, but we are keeping up all of our work in this front. And just to highlight the importance of these subsidies, it's been very significant nationally and here in Connecticut. Across the country, for this year, there are 14.5 million people enrolled through the marketplaces, and 13 million of those people are receiving subsidies. And here in Connecticut, we have seen our percentage of consumers receiving subsidies increase pretty dramatically under the American Rescue Plan Act, from where it normally hovers around 70% to 83% for this year. So that is very significant. 21,000 consumers will be ineligible for subsidies if ARPA is not extended. Those are the people who are over 400 of the federal poverty level, 400%, and would not be eligible without the ARPA special language. And the financial impact of this is also significant. $14.8 million of premium tax credit assistance is received per month, which would be lost, which adds up to nearly $178 million for the year. And that's just the population that would not be eligible completely for subsidies. There's also the enhancement of the subsidies for those under 400 of the FPL. And as part of the notice of benefit and payment parameters for 2023, you may also recall that we've been talking about some changes that were proposed and adopted for the federally facilitated marketplaces to require issuers in the FFM states to offer standardized plans. CMS is convening a work group. We just received a notice from them on standardized plans and has contacted Access Health along with some other states to participate in this group, as we have had standard plans since the beginning of the exchange. And so they'd like us, to participate and share our knowledge and experience with them to help them developing this for the FFM. And then finally, another item of interest is a recent projection that was released by the Kaiser Family Foundation on the rebates for 2021. The ACA requires the health plans to meet a medical loss ratio of 80% of premium dollars to be spent on claims costs, and the other 20% may be spent on administrative costs, overhead, and profits for the insurance company. If a carrier spends less than 80% on claims costs, members are entitled to rebates. The calculation is made using a 3-year average, and so for 2021, this will actually be the first year in a while where the 2018 premiums and rebates have not been included in this calculation. And this is important because in 2018, there were higher premiums and resulting rebates because of the defunding of the CSR payments at the end of 2017 and the silver loading that exchanges, including Access Health, started doing, and also the great uncertainty at that time about the future of the ACA. And also the impact of COVID utilization and claims cost is also a factor for the rebates of late. So the Kaiser estimate is that the rebates will be $1 billion. This is across the whole country in individual, small group, as well as large group. And the rebate payments are issued in the fall. The final information will be released by CMS and the rebates go out. There have not been large rebates just in Connecticut, just as a piece of history. So if anybody has any questions or comments.
Thank you very much, Susan. As you say, that history may be slightly different given the pandemic. So we'll have to see how these numbers play out here in Connecticut. So, any other questions for Susan? If not, then James, the floor is back to you for a summary of the next meetings.
Sure. Very quickly, obviously the audits as they evolve will come back to the board with audit results. We will also come back to the board as we continue to evolve with the Broker Academy, keep the board abreast where we are, as well as we are working diligently developing a strategy around a subsidiary. And again, we're working with the strategy committee. We'll come back to the board once we have all of our ducks in a row, and the strategy committee has signed off on everything that we're working. Thank you. That's where we are, Mr. Chairman.
All right, thank you so much, James. Any further issues that anyone would like to raise? More comments? All right, Vicki Veltri, one last chance to wish you well in your new endeavors. Thank you so much for all your service.
Don't make me Charlie. Don't make me.
I'm going to take your motion to dismiss this meeting.
I will happily make the motion. Thank you so much.
Thank you so much. Second?
Ted, I'll second.
Thank you, Ted. Charlie Klippel, yes.
Thank you. Paul Philpott. Claudia Gualtieri.
Yes.
Dietrich Gifford.
Yes.
Ron Ritter.
Yes.
Diva Hernandez.
Yes.
Theodore Doolittle.
Yes.
DC Woods.
Yes.
Thomas McNeil.
Yes.
Victoria Veltri.
Yes.
And Matthew Brackman.
Yes.
Thank you.
Thank you all very much. Great to see you. Look forward to the next meeting.
Everyone.
Bye.
Thank you all.
Thank you, Vicky.
Bye, Vicky.